Okay, good evening, everybody. You're very welcome to DCU's MSc in Physiotherapy webinar. We'll just give it a couple of seconds to allow a few people to join because it just takes a couple of minutes for people to come in from the waiting room. But as you wait, my name is Frank. I work on the postgraduate recruitment team here at DCU, and I'm joined by Clíona, who is the program chair of the MSc in Physiotherapy, and also my other colleague Jen, also from the postgraduate recruitment team. Um, Before I get started, just a couple of bits of housekeeping. So it is being recorded, so you will get a copy of the recording afterwards. And then there's a Q&A box at the bottom. So any questions that you have along the way, put them in, and then at the end of the session, we'll come and we'll answer as many questions as we can. I'm going to give a quick overview, kind of DCU to start. That'll take just less than 5 minutes, and then I'll hand it over to Clíona, who will run through the MSc in Physiotherapy program. But yeah, to get us underway, I'm just going to share my screen quickly. So I know we have people from Dublin. We have past students registered. We also have international students. So I know everyone kind of has varying degrees of knowledge of DCU. So I'll just give you kind of a quick overview to get everybody up to that sort of same level of knowledge. So DCU, here we have about 20,000 students across both undergraduate and postgraduate. These are spread across our three academic campuses, all in the north side of Dublin. I'll show you kind of on a map on the next slide where exactly they are located. We have over 80 different postgraduate programs, with MSc in Physiotherapy one of being one of our newest programs, which just launched last year and took its first intake. We have students coming from over 135 different countries and also all corners of Ireland as well. And something that we're very proud of is our graduate employment rate, which currently stands at about 93% of graduates being either in further study or employment 9 months after they graduate from DCU. Outside the academic bit as well, we do also have plenty of clubs and societies. I know sports and physiotherapy are obviously tied, so we have lots of sports teams across all the kind of major sports: GAA, rugby, football, volleyball, basketball. Um, in terms of just giving you a bit more of a look at where we're actually located, so in the north side of Dublin, we're about 20 minutes by public transport from the city centre. We're about 15 minutes from Dublin Airport, so kind of in that midway point between the two. You can see kind of there in the dark blue boxes where our campuses are located. So the MSc in Physiotherapy is mainly based in the Glasnevin campus, so that's where you're going to be for the most part, unless you're staying in accommodation on one of the other campuses for international students in particular. But that's where you're going to be located. We have all the facilities are located on that Glasnevin campus. Getting to DCU is particularly for students who maybe are living outside of Dublin. Lots of on-campus parking. We're lucky. That's lots of availability if students do choose to commute in and out. Well located by or well linked by bus all across the city as well, which is great. So if you're coming from the south side or another part of Dublin as well, it's very easy to get to us. Bike sheds obviously are spotted across the whole campus. So again, if you want to cycle, it's a very viable way of getting there too. And then also we're very close to Drumcondra train station. So if you're commuting by train as well, it's only about a 15, 20-minute walk from the train station. Um, and then the last slide, just to run quickly through some of the support services that students get access to while they're studying here. So for international students, there'll be pre-arrival webinars. We have regionally based support teams who will help you kind of with that transition to life in Dublin. And also then a student app you'll get access to before you come, where you can meet other international students. While you're here, there'll obviously be an orientation week in your first couple of weeks as a student, where you'll kind of get the grips with DCU, get to meet your classmates, that sort of thing. A student advice center, which goes from financial advice to academic support in our student writing center. And then there's also health and well-being support, so heavily discounted physical health support and also free mental health services as well for students who are here at DCU. And another part then is the DCU Career Service, so a completely free career service to offer career fairs, CV and LinkedIn workshops networking events, and then also one-on-one career guidance counseling to all DCU students throughout your journey as a student here. But that's all for me. I hope that kind of gives you a quick, nice overview of the university, and then I'll pass it over to Clíona, who will share her slides and go through the physiotherapy program.
Perfect. Thanks a million, Frank. And hello, everybody. It's lovely to be here today. I'm just going to share my slides for one moment. Sorry, just now. Frank, you can just let me know there if you can
Yeah,
see
they're working
that
all good.
okay.
Yeah.
Is that all right? Okay, I'm just going to move some screens here. Perfect. So good evening, everybody, and good morning, everybody. It's lovely to be here with you, and thank you all so much for your interest in our MSc in Physiotherapy program here in DCU. And I want to start off by thanking Frank and Jennifer for all of their assistance in preparing for this evening's webinar. It's really, really appreciated. So to start off with, I do want to welcome you to the webinar and to introduce myself. First of all, my name is Clíona O'Sullivan and I am a physiotherapist by profession, and I'm a full professor of physiotherapy here at DCU and also the program chair of the MSc in Physiotherapy program here at DCU. As Frank said, we are based in the School of Health and Human Performance, which has a really strong tradition and very well established programs in the area of sports science, athletic therapy and training, and physical education as well. So physiotherapy aligns very, very well with the other program offerings within our school. During the course of the next 20 to 30 minutes, perhaps, I'm just going to take you through some various aspects of this presentation. Spent a few minutes talking about physiotherapy as a career. I'll go into some detail about our program here in DCU. Spending a lot of time on our clinical education program within our master's program, and then the applications process and different things that you should be aware of. And then, as Frank said, we will have time at the end for any questions and answers that you may have that we haven't covered during the evening. So just to begin with, I suppose, I think by virtue of the fact that you're online with us this evening, I imagine you know an awful lot about physiotherapy already. But I suppose just to I suppose capture what it is as a career and as a profession. As physiotherapists, we really work with people across the spectrum of health and well-being. We work with elite athletes at the height of human performance, and we work with people during their most vulnerable moments. And we work across the lifespan, from neonatology and tiny babies to older persons care in order to maximize function, performance, and quality of life. And Irish trained physiotherapists work all over the world. And I suppose as physiotherapists, we're very much at the forefront of our health systems and our health services. And throughout the world, health systems are changing, to cope with aging populations and multimorbidity and more complex situations and contexts. And really, physiotherapists are on the front line of that, delivering transformative care and also innovative care around digital health and other service models. So it's a really exciting career. It's a career. I'm graduated, I think, 29 years this year, and it's a career that has really changed in that time and will continue to transform and change. And that's really what we I suppose what we aspire to here in DCU. So in terms of our program vision, it's really rooted in that context of for excellence in clinical practice for good health and well-being. And our vision here in DCU is that our physiotherapy program will be known for the caliber of teaching within it and the student experience, and that we're known for the quality and impact of our research programs. And underpinning all that is our clinical partnerships, of which we're very, very lucky to have very, very strong clinical partnerships here in Dublin. As with any organisation, our people are at the heart of what we do. And we have been joined over the past year, as Frank said, we launched the programme in September. So over the past year, we started to build our team, our physiotherapy team here in DCU. So we have, and some of the team may be online. I am listening as attendees this evening as well. So Emma is our practice education coordinator, and this is a really, really key role, as practice education makes up a third of the programme. Then we have Dr. Deirdre Murray, who is Associate Professor in Neurorehabilitation, Dr. Orla Deegan, Lecturer in Musculoskeletal Physiotherapy, Deirdre Phelan, Lecturer in Cardiorespiratory Physiotherapy. And then we've recently been joined by 3 clinical tutors, and these are staff who are based here in DCU that really facilitate and support student learning while our students are on clinical placement. So that is Ronan Langan, Sinead Coyle, and David Casey. And then we're really, really fortunate and lucky to work with 2 excellent people, Richard Hughes and Aisling Scally, who support the everyday running of the programme. And of course, as academic faculty, we have, the privilege of working with our young people, and that is the same for us here in DCU. So this is the photograph of our first cohort of physiotherapy students on the master's programme here in DCU, who are studying their year 1 of the programme at the moment. So I'm going to move on to just to give an overview of what the programme is like and what you might expect, coming on to the programme. So as I said, it's based here in the School of Health and Human Performance, and as Frank said, on the Glasnevin campus. And we're based between the newly opened and Polaris building, and then we also have some physiotherapy specific clinical skills labs in the Lonsdale building, which is just literally across the pathway. For students starting with us this September, they will be with us for 2 full calendar years. So it is a very intensive 2-year full-time programme. It is worth 180 ECTS credits. So students complete 30 ECTS credits every semester. So students are with us in the autumn semester, spring semester, and summer semester, and again the same during year 2. And here in Ireland, our regulator for health and social care professions is called CORU, and we are going through the programme approval process with CORU this year, with a view to having full approval in place by early next year, in time, well in advance of our first cohort of students who will graduate September 2027. So moving on then to our programme philosophy, I suppose our programme has been designed to adhere to the CORU criteria for education and training of physiotherapists and the CORU standards of proficiency. And they're also aligned with the standards set by our professional body here in Ireland, the Irish Society of Chartered Physiotherapists. So our programme builds on the very strong tradition of excellence in health, sport and exercise science here in our School of Health and Human Performance. And we use student-centred and practice-focused teaching and learning approaches to ensure that all students during our programme have the opportunity to develop the knowledge, skills and professional attitudes for modern and contemporary physiotherapy practice, that our students are able to work with diverse patient population and client populations, and that they're able to work within interprofessional teams in ever-changing and dynamic clinical environments. And our program is also rooted to the principles of sustainable development in line with key strategic objectives of our university, with an emphasis on health equity, inclusive health, and sustainable physiotherapy practice. So, from a teaching and learning point of view, our program looks like this. So, each block here on this figure represents a module or a learning unit within the program. And of course, our students are coming in with a BSc degree, so they already have, an excellent level of learning, and we're really building on that, for clinical physiotherapy. So, just briefly, the boxes in blue represent professional practice modules. The boxes in orange represent clinical practice modules. So they're specific to physiotherapy training. The boxes in pink are research relevant modules, and then the green boxes represents the clinical placement blocks. So I'm just going to take a few minutes to talk through each of those boxes and describe in a little bit of detail what is covered in each of those modules. So if I begin at the very bottom of the page, so the idea is that, or the bottom of the slide, the idea is that student learning is built upon as students progress through the program. And on the left represents the autumn semesters or semester one. In the middle blocks are the spring modules or semester two. And then over to the right are the modules that take place during the summer semester. So as you can see, students are with us for the entire 2 years, but I'll go through that in a little bit more detail now. So the first module at the very bottom, which is a year-long module, is called Introduction to Physiotherapy Professional Practice. And that really covers all of the professional relevant information and content that students need in order to proceed to clinical placement. So it covers things like confidentiality, communication skills, manual handling, etc. So really core requirements that we have before students can go out on placement. Students also build on their prior learning in anatomy, and we have an applied anatomy and neuroanatomy module. And that's really to allow students to develop a lot of the manual and palpation skills that are required for physiotherapy practice. Students build on their prior learning in the area of exercise science or sports science, and we do a behavior change and exercise for non-communicable disease module. So that is about applying that lovely information and knowledge that students have now to clinical populations. And then we have 3 year-long modules that really align to the core pillars of physiotherapy practice. So musculoskeletal physiotherapy, cardiorespiratory physiotherapy, and neurological physiotherapy. And they are year-long modules that the students begin in September and complete in April each year. In semester 2, then, also of year 1, students do a module with me called Research Informed Practice. And this, again, is building on prior learning achieved during their bachelor's degree in research. And it's a case-based module where students get the opportunity to, I suppose, apply research findings to specific cases and consider how that, informs or changes their practice. So it's very workshop led and a very, very practical module. And then at the end of semester 2, which is towards the end of April here in Dublin, students begin their first clinical placement module. And this first placement is a 7-week placement with one of our clinical partner sites. That takes students up to early to mid-June. And then they immediately proceed to a different placement. In terms of, it may be a different placement site altogether, but it's certainly a different placement speciality. And I'll speak to that in a minute. And students will be finished their placements by the end of July, and then they do have a break, and that's really, really important for our students. They do have a break for the month of August, and they join us again for to begin year two at in the beginning of September. Then in September, they're with us for 7 weeks, up to about Halloween time or the end of October. And in that time now, we're now proceeding into more advanced practice, more advanced clinical modules. So the first module there is called Specialist Physiotherapy module. And this will be delivered by clinical specialists in physiotherapy. And there's four main pillars to that module. So students will cover areas such as specialized pediatrics, oncology, mental health, and pelvic health. So again, very specialized areas of physiotherapy practice, but that build on the key pillars of practice: neurology, cardiorespiratory, and musculoskeletal that students have completed in year one. Students then also do a module on pain assessment and rehabilitation, and a large module on health and disability across the lifespan. And this is really where students get the opportunity to learn about, I suppose, disability from in terms of children's disability, in terms of acquired disability, but also age-related disability as well. So a really, really important module for the context that we work in as physiotherapists. And then at the end of October, students then proceed to their third clinical block. And again, this would be a different clinical speciality. And they would complete this clinical block from the end of October to the middle of December. Students are off then for about a month, from the middle of December to the middle of January, and they come back into us again for 7 weeks from January. And here again, they do two clinical modules. One is called complex care, and this is a case-based module where students get to work with other health profession students. So the focus in this module is, I suppose, complexity. So looking at complex cases, looking at complex settings and complex scenarios, but also getting the opportunity to work with other health professions students. Students complete a module in sports physiotherapy, and as Frank alluded to, I suppose, here in DCU, there is an extremely strong tradition of sports across multiple different sporting codes. And then during this time, they also do two professional practice modules. So the first one there, and again, I'm moving from the bottom towards the top, is called Advanced Physiotherapy Professional Practice and Service Innovation. And this is where the students get to learn about quality assurance and quality improvement in clinical services, and also get an opportunity to think about innovation in clinical services. So in terms of new models of care, new and innovative pathways of care, new referral pathways, but also how do we as clinicians and as physiotherapists leverage in advances in things like digital health and technology to improve patient care. So again, so that is our advanced physiotherapy professional practice module. And then the next module up is called Health Systems and Policy for Sustainable Development. And this is where I suppose students really get to look at things like global burden of disease, global health, determinants of disease and disability and health. And also get the opportunity to think about health systems, because health systems, are very, very different throughout the world. And it's really important for all clinicians that we understand the health systems within which we work and the policy that informs those health systems, and how in turn, as clinicians, we can inform policy as well. So students during that module get the opportunity to understand health policy as well. So students are with us then until the beginning of March, and then they go out on their final block clinical education for. And again, this is an 8-week block where students complete their final placement block. It brings them up to the required hours required for professional physiotherapy practice training here in Ireland. And then the last piece is where students come back into us for the summer period to complete a capstone research project. And here students are assigned a research supervisor who is an academic member of staff here in the school, and they complete a piece of research under the supervision of their supervisor. So a lot of time spent on that slide, but I do think that it's worth it to describe the program in detail. I suppose, we do use a range of teaching and assessment approaches. So certainly there are lectures, but also lots of practical classes, problem-based learning, case-based learning, lots of group work. And I think this really reflects modern day clinical work where we rarely work in isolation. We're always working within teams. We are also developing our capacity for clinical simulation and as I said previously, interprofessional learning approaches as well. So we have a mix of assessment approaches because it's really important that we ensure that students are safe and that they're able to practice effectively. So assessment is a key part of our program. So assessments are staged throughout the path, the program pathway, if you like, and students are supported through their assessment and I suppose, are very aware of when assessments are occurring. So we have a mix of assessments. We use, unseen written exam papers. We use practical exams. We use group presentations, individual presentations. We use assignments, written assignments paired with interactive oral assessments. And of course, there's also assessment on clinical placement, which is for physiotherapy training here in Ireland, our assessment is standardized. So all of the universities use the same assessment framework for physiotherapy students in Ireland, and we're aligned to that national framework for student assessment on clinical placement. I suppose a key part or a key feature of the program is research-informed teaching. It's really important that our students are critical thinkers and lifelong learners because, again, it is a profession that is ever changing, ever evolving, and ever strengthening. A feature of the program is our small class size. So our intake for 2026 is 25 places. So it's a very small class size, which I think students like and lends itself to a very positive experience in learning. And as I said, clinical learning is key in terms of our clinical placements. So, and that just brings me to, I suppose, the clinical education program that sits within our MSc in physiotherapy here in DCU. As a physiotherapist, I worked for 10 years as a clinician, and for 4 of those years, I was a clinical tutor. So, I suppose I have first-hand experience of the transformative impact of practice placement and clinical placement and how important it is in student education and health professions training. Our clinical placements are really the backbone of all professional clinical programs, and they really are the experience that allows our students to translate the knowledge and skills that they learn here with us on the DCU campus to real world cases and complex contexts. And as I said, within the program, we have 4 clinical blocks. All of our placements are in Dublin. Most of them are very local to the university, with some of the placements in the wider Dublin area. And we have excellent clinical placement partners, both public and private healthcare providers in hospital settings, in primary care, community and integrated care settings, and also I suppose, a range of clinical specialties as well. So I have listed our clinical partners here, and this is a list that is constantly building, which is fantastic. Some of you would be very familiar with some of the places named here. So the first three there are three large public hospitals, university teaching hospitals here in Dublin, on the in close proximity to DCU. We're also delighted to partner with three primary care areas, again, local to the university here, Dublin North Central, North Dublin County, and Dublin North West. And they, provide really rich student experiences in terms of delivery of physiotherapy services in community, in chronic disease programs, in children with disability networks. So within those placement partnerships, there's a really rich diversity of clinical experience. We're also delighted to partner with UPMC Santry Sports Surgery Clinic, which is not too far away from us, and then a range of, I suppose, transitional and rehabilitation services. So Peamount, Mount Carmel, Beaumont Lodge, and Leopardstown Care Centre, and also Highfield Healthcare, which specialises in mental health services. So you can see there, I suppose, the range of settings that our students are going to get the opportunity to train in. And within those settings, our students will complete placements in cardiorespiratory, in rheumatology, in orthopedic inpatients, musculoskeletal outpatients, older persons rehabilitation, neurosurgery, neurorehabilitation, sports medicine, mental health, and then community services, rehabilitation services, and domiciliary services as well. And again, spanning the lifespan from both children's disability services to older persons care. So really delighted and just want to take the opportunity to thank as well our excellent clinical partners that we have here in DCU. So moving on, I'll just check my time to the application process. So the entry requirements, first of all, and we do get a lot of queries about our entry requirements. And just to say, we have revised and revamped our website as well to have as much information on it to help potential applicants. So our entry requirements are a prior degree at BSc level or level 8 in our national framework for qualifications here in Ireland in an area of health sciences, such as athletic therapy, sports science, kinesiology, etc. Students must have a minimum 2H1 degree, and the core, I suppose, subject requirements that we look for are prior learning in human anatomy, human physiology, biomechanics, and exercise science. And they are absolutely kind of crucial subject areas, I suppose, that underpin the practice of physiotherapy and that we build on here in the program. We also have English language requirements, and you can read more about those on the web page. And we do, I suppose, reserve the right to interview in certain situations. So they're just a brief overview of our entry requirements, but there's a lot more detail on the web page that you can look at in your own time. In terms of the application mechanics, then applicants must apply online through the DCU student application portal. So applications that are sent in by email to the school or to myself will just not be considered. Applicants have to come through the student application portal. And there's different aspects to that. And the first, there is a page on it where students outline their previous work experience, for example, and it's almost like a CV. And it's really, really important that students complete that comprehensively, so we can understand the type of work experience, their prior education, etc. that students have. Students are also will have to upload their transcripts. Now, for students who are in their final year at the moment, you may not have the transcripts for your final year because you may not have completed your exams and your final assessments, and that's okay. It's just but it is important to upload all of the transcripts that you have to date. We also ask students to complete a personal statement, and we do have a template for that on the online applications system. And it's really important that students use the template that is provided. And then we ask for two letters of reference. One must be an academic letter of reference from your prior degree, and one must be a professional or applied reference. So perhaps somebody that you have worked with or worked for related to physiotherapy or to health in general, or perhaps an employer in the past in that has that knows you well and can speak to your suitability. It's really important that all I suppose, that all of this documentation is that you have submitted in advance of the closing date. And just to be aware, for your referees, they must post their reference directly onto the portal system. And we do have to have the references by the closing date. So it's really important to let your referees know that they have to have it. And I would advise getting them to upload their references a few days in advance, because otherwise the application will be considered incomplete. So that's really, really important. The fees are outlined here on this slide. So €13,000 per year for EU students and just under €26,000 for non-EU students per year. We also do have some program requirements that are really, really important to know about, so that students coming onto the program have to comply with our program requirements. So the first one there is around Garda vetting and police clearance. So any student who has lived outside of Ireland for more than 6 months is required to get a police clearance certificate from that country where they lived for more than 6 months. We have health screening requirements that that need to be undertaken by all students. And just to note, that is an additional cost, and the cost is different depending on whether students have had complete vaccination programs already or not. And again, successful applicants will be furnished with that information with their letter of offer. There's a number of mandatory trainings that students have to do during year one before they go on placement. So, for example, manual handling, CPR, GDPR, so that's our data protection regulation. And there's a number of others as well that, again, we navigate you through as part of that first professional practice module. And then there are also placement requirements. So we do have a uniform so that students must wear while they're on placements. And then, certain professional code of ethics that the students must be aware of before they begin their placements. And again, we do guide students through that once they're on the program and the requirements for that. So that brings me to the end of my presentation, and